Thank you very much, Dr. Lustig. Our next speaker is Dr. James Rippey from the Rippey Lifestyle Institute, and he's going to talk to us on health implications of fructose, sucrose, and high fructose corn syrup. What do we really know? Let's thank Dr. Rippey for joining us today.
Well, thank you, Penny, and I'm delighted to be here. There's only one other speaker after me before the question and answer. I do live in Boston. I'm on the faculty at Tufts as well as having my own research organization. And when it comes to the Q&A, since I do live in Boston, I'd appreciate it if nobody mentions what happened to the Patriots last year, and certainly not what's happening to the Red Sox or the Bruins this year. So with those caveats, I'm willing to take on pretty much anything else. What I want to do today is really talk about what we know, what we think we know, and what we might know when it comes to sucrose, high fructose corn syrup, and fructose. Let's see. First of all, to disclose, a couple of disclosures. I'm a cardiologist, and we do work. I also run a research laboratory that looks at nutrition, weight management, and we write a lot about that. So we have a number of disclosures here that relate to organizations and industry partners who use fructose, high fructose corn syrup, or sucrose in their products. Today, my goal is to help you understand if there are differences, help us understand if there are differences in the metabolism of these three substances. Could I have some more water? Understand the strengths and weaknesses of the evidence that supports those links, and then present some randomized controlled trials, both from my own research laboratory and from other people that deal with these issues at normal consumption levels in the normal way we consume these products, namely high fructose corn syrup and sucrose. I want to start out by putting this in a little bit of perspective. Since I do live in Massachusetts, this is where the boats took off in the movie The Perfect Storm, where they encountered a whole series of things that were very unusual to happen together that caused 100-foot waves and the boat to capsize and everyone lost their life. Well, I would submit when it comes to high fructose corn syrup, sucrose, and fructose, we have essentially the perfect storm for a lot of miscommunication and misinformation. First of all, the epidemiologic studies are very interesting. Epidemiologic studies, as Dr. Bray has acknowledged, do not establish cause and effect. They raise interesting questions. They establish associations, as everyone in this audience knows. Unfortunately, in retrospect, high fructose corn syrup was probably not the best name. As Dr. White has mentioned, it probably should have been middle fructose corn syrup because it basically has the same amount of fructose and sucrose as does sucrose. This is an emotional issue. A lot of the diseases that we're talking about are diseases that carry enormous significance: heart disease, cancer, obesity, metabolic syndrome, diabetes. These are things that matter a lot. And because we're Americans, we want a simple answer to this, and this is, I would submit to you, a very complex issue. First of all, is there a unique link between high fructose corn syrup and obesity? I must say that on this panel, this is probably the only thing that we will all agree on, that there is not a unique link between high fructose corn syrup and obesity. This is a slide that Dr. White has already shown. We no longer call it the Bray hypothesis, in deference to my friend and colleague George Bray, but this was the commentary that he and Dr. Popkin, who I know is also in the audience, suggested that there was a temporal association between consumption of high fructose corn syrup and obesity. Well, there are lots of things that now, and Dr. White has talked about this in detail, so I won't go into it in great detail. There are a number of countries where there is no high fructose corn syrup, essentially. There are lots of, and these are countries where there's a significant amount of obesity, a significant amount of diabetes. There's a worldwide much more sucrose consumed than high fructose corn syrup. There are lots of reasons to think that this might not be true. I think we would all agree in this audience that there is not something unique about high fructose corn syrup that causes obesity. But there's a related issue, and that issue relates to whether or not, and you've now heard a number of the previous speakers talk about in various ways pure fructose versus pure glucose research. And so I just want to quickly take you through a couple of slides that relate to pure fructose versus pure glucose research. The reason that this is important to do is because the average person cannot tell the difference between fructose and high fructose corn syrup. And if you don't believe that, go out on the internet where there are hundreds of thousands of messages back and forth about high fructose corn syrup. And there is not a week that goes by that I don't have a dialogue with a physician, either a television physician or somebody who's got their blog on the internet, who cannot distinguish between high fructose corn syrup and fructose. So it makes the fact that there are research laboratories doing good research comparing fructose to glucose, it makes for a problem when we try to communicate that message to the public. So you've seen this slide or a variant of this slide before. I must say, I have not seen so much biochemistry since my first year at Harvard Medical School. I mean, it was painful then. and it's, believe me, as a cardiologist, it's no less painful now. But this is from Luke Tappy's very good review. And incidentally, I list all the studies that I'm going to talk about in sequence. I list in the references. So I would really ask you to go and look at all these studies and make up your own mind about this. The reason that people started studying pure fructose versus pure glucose, as previous speakers have said, is because they're metabolized different in the liver. Fructose is taken up essentially 100% first pass in the liver. Glucose, only about 20% goes to the liver. But as Dr. White has pointed out, they're not independent. They're linked together. As you look at this diagram, you see, yes, you can take fructose all the way to making fatty acids. But most of it goes to glucose and glycogen and lactate. And I'll get into that in a little bit more detail. There are a lot of misconceptions about de novo lipogenesis and how big a deal that is. How much of the fructose we take in actually gets turned into fat. And I'll get into that in just a minute. So those are the reasons why people were studying pure fructose versus pure glucose, because they said, well, it's metabolized differently in the liver. There may be other things that make it different from a metabolic standpoint. And as Dr. Lustig pointed out, and others have pointed this out, we don't consume pure fructose or pure glucose. We consume them together. It's always fructose and glucose. It's not fructose or glucose. So this is work, and some of you will have seen these slides before. This is work that was done, excellent work done in Peter Havel's lab. The first author on this is Teff. On the right is work done in my lab. The first author is Kathleen Melanson, who was a postdoc in our lab at the time. You can see that if you compare 25% of calories as pure glucose versus pure fructose, guess what? Glucose causes a higher rise in blood glucose than does fructose. But if you put them together, as we did, same protocol, same metabolic unit overnight studies, same percentage of calories, if you put them together as we always consume them, as either high fructose corn syrup or sucrose, all the differences disappear in terms of blood glucose. Well, everything else exactly, you'll see a pattern here. Glucose goes up when you give glucose. Insulin goes up more than when you give fructose. Give them together as we always consume them, you get less of a bump, and they are identical. And you're going to hear this as a constant theme. High fructose corn syrup and sucrose behave identically. They're half fructose and half glucose. You get, when you feed glucose, since the short-term energy regulation is intertwined, you get more of a bump in leptin. Your body says stop eating. If you get less of a bump in fructose, but if you put them together in high fructose corn syrup or sucrose, you get exactly the same response for leptin, and you get less of an inhibition for ghrelin if you give glucose. But if you put the two together in high fructose corn syrup or sucrose, the ghrelin is identical. So really the point is important, interesting work from Teff et al. Comparing fructose to glucose. We don't eat glucose or fructose. When we first started studying this and we submitted them to journals, people said, well, everybody knows that high fructose corn syrup and sucrose are the same. Well, the public, it doesn't know that. Neither do a lot of the food manufacturers who've taken out high fructose corn syrup and said, we have no high fructose corn syrup in our products. and what they've done is substituted sucrose. It's American marketing at its best. So the same lab, Peter Havel's lab, this time Kimber Stanhope, the first author, went back after we did that and replicated our experiment and basically compared high fructose corn syrup to sucrose. This was their article in AJCN in 2008. Got exactly the same results that we did, but it extended them because they now got the same results in men. We had only done females, normal weight females. In America, it's not normal weight anymore. It's healthy weight, but it's no longer normal weight in America. And so they also did males, and they also extended it by showing there was no difference in terms of triglyceride production. We also have done the triglycerides. We got very much the same thing, although since we didn't have males and females don't generate triglycerides quite as exuberantly, we got slightly lower values. But high fructose corn syrup and sucrose generate the same triglyceride response after meals in a metabolic unit study. And I put in the uric acid here, the acute study that we did on uric acid, not because it fits here, just because it's a separate issue that I'm going to talk about in a little bit. But acutely, there's no difference in terms of uric acid when we've done those in 24-hour studies. Okay, so, and you take all the short-term energy regulating hormones and you put them together and you say, well, the reason why fructose is bad for you is because it doesn't make you feel full and you eat more, some of the stuff that Dr. Lustig just talked about. But when you compare how we eat these things always, glucose and fructose together, high fructose corn syrup and sucrose, identical appetite ratings. There is one where there's slightly more for sucrose than high fructose corn syrup. So I took this slide shamelessly from Dave Clearfield, who's the next speaker. He said he would let me do that. He wouldn't use it. We have a long history in the United States of trying to take one thing out of the diet and say, aha, that's it. That's what causes obesity. It's not all the calories we're eating. It's not our inactive lifestyle. It's not the number of calories we're eating. It's grandma's cookies. It's sugar-sweetened beverages. It's high fructose corn syrup. Well, it's never worked. It's never worked. And I would submit that we made that mistake in high fructose corn syrup, and I think we have the real potential to do that in sugar-sweetened beverages again. This seems to like that slide. All right. As Dr. Lustig mentioned, the American Heart Association has suggested criteria for what they regard as, and I'm a member of the American Heart Association, that the average male should not consume more than 150 calories from added sugars, and the average female not more than 100. It's an interesting idea. It's presumably because above those things there may be some increased risk of heart disease. So we looked at that specifically. Does high fructose corn syrup or sucrose increase the risk of heart disease? This happens to be a study that was done for 10 weeks. It was done on 64 individuals where we gave them either 10 or 20%. I should mention also that those criteria set forth by the American Heart Association are currently exceeded by 90% of people in the United States. So we have another guideline that nobody is following, and I think nobody is likely to follow. So we did a 10-week study with 64 individuals where we basically gave them either 10 or 20% of their calories as either high fructose corn syrup or sucrose. I'm presenting, and you will see on a whole series of slides now, pooled data because high fructose corn syrup and sucrose in all of the following experiments that I'm going to talk to you about behave exactly the same. And they behave exactly the same, in this case, at 10 and 20% of calories. So I'm just giving you pooled data from the entire 64 people, baseline and week 10. No changes in total cholesterol, no changes in LDL. HDL fell by about 1.5 milligrams per deciliter. That's not a clinically important fall, but it's very common in a low-fat diet, which when you give people a lot of sugar, it becomes essentially a low-fat diet, that HDL falls. And triglycerides rose a little bit, about 7 milligrams per deciliter, did not achieve statistical significance. We then repeated the study with a much larger study, 352 individuals, where we gave people either 8% of calories as high fructose corn syrup or sucrose, 18% or 30% of calories. Those are levels up to the 90th percentile population consumption for fructose. So we wanted to see what would happen if you push it up to the extreme within the normal population consumption level. Similar data, once again, total cholesterol and LDL, no differences. HDL, again, achieved statistical significance, but it was less than 1 milligram per deciliter difference. Just a very large study, so a very small amount will make a difference. And we did get about a 10% bump in triglycerides. Everyone who has studied high carbohydrate diets has gotten a bump in triglycerides. So I don't know what to make of that. These are clinically normal values. The triglycerides went from 104 to 114. If you think that a triglyceride of 114 is a significant risk factor for heart disease, you have to rewrite every cardiology textbook in America. So, maybe there's something there, but these are normal, clinical normal, but they did go up. So, at least on the lipid side, I think it's hard to make a case that high fructose corn syrup or sucrose at normal population consumption levels increases the risk of heart disease. How about the metabolic syndrome? Both Dr. Bray and Dr. Lustig have talked about the metabolic syndrome. Again, a study, pooled data, 352 individuals, no changes in blood pressure. Actually, these are normal blood pressures, and you can see the p-value is 0.6. It's actually lower at the end of the 10 weeks than it was. Now, I'm not suggesting that 30% consumption of either high fructose corn syrup or sucrose is a valid treatment for hypertension. But it does, the p-value, it's actually lower at the end of the study. Waist circumference, these are the established risk factors for metabolic syndrome, actually went up less than half a centimeter. Because it's a huge study, it did increase. Fasting glucose didn't change. HDL changed less than half of a milligram per deciliter. And triglycerides, again, I've already shown you that data, went up about 10%. What about blood pressure? Does high fructose corn syrup or sucrose increase blood pressure? Another risk factor for heart disease and stroke, a major risk factor, something that's really common in the United States. I've already shown you the data, so I'll just repeat here. No difference, pooled data, no difference between high fructose corn syrup and sucrose, no change over 10 weeks at up to 30% of calories. It is true that Stephen Piper's work was only on fructose, but Stanhope et al. In the JCI article found exactly the same thing, no increase in blood pressure. So there are differences of opinion and differences in data. What about uric acid? People have argued that uric acid, it causes endothelial dysfunction. I've already shown you the acute data. Here is a subsample of the 352 people, 98 people, area under the curve, multiple measurements at the beginning and at 10 weeks. No difference in uric acid at normally consumed levels in the ways we consume fructose and sucrose, as high fructose corn syrup and sucrose. What about non-alcoholic fatty liver disease? We've had several people talk about that. Here again is the diagram from Lay and Tappy showing that there is an interaction between fructose consumption and glucose consumption. And we've heard that fructose goes to fat and that the de novo lipogenesis goes up dramatically. Well, is that really true? This is a diagram, and this is where I left the boat with the biochemistry. This is from Mark Hellerstein's major review. Mark Hellerstein has been one of the leading people in this area. This is de novo lipogenesis. You can see pretty much what Dr. Lustig said. You get citrate, which is this all happens outside the mitochondria. It happens in the cell cytosol. You get citrate, which is cleaved to acetyl-CoA. The first committed step is malonyl-CoA. That is an inhibitor of the oxidation of fatty acids. So you can push fructose into this. Fructose is known to be more lipogenic than glucose. I think everybody is in agreement on that. But let's now look at what the totals are on that. In the Western diet, we consume between 100 and 150 grams of fat a day. How much does lipogenesis, de novo lipogenesis, create? How much of that, 100 to 150? Well, in the fasted state, about 3%. In the fed state, about 5 to 7%. And the total amount of fat generated, according to Hellerstein's work, from de novo lipogenesis, 1 gram. 1 gram out of 100 to 150. Not sure that's going to make anybody obese, But if you live to be 2 million years old and you get this browning of your ribs, you probably will get fat from 1 gram of extra fat a day. Well, what about this fractional de novo lipogenesis? As Dr. Lustig has said, you feed fructose into the system and it goes nuts. You create de novo lipogenesis. This is, again, work from Hellerstein and Schwartz. You can see that what this study did was it gave healthy young men infusions of 10 milligrams per kilogram per minute of either fructose or glucose, pure fructose or pure glucose. 25 grams of either fructose or glucose an hour for 6 hours. And yes, the fructose behaved differently than the glucose. The percentage of the DNL, the percentage of all the VLDL that your liver is packaging went from 1% to 32%. Sounds like a catastrophe, doesn't it? What's the total? About 10% of the fructose consumed went into de novo lipogenesis, and you generated about 1 gram of fat an hour. So when I talked to Mark Hellerstein about this, he said, yes, there's a qualitative difference, but the quantitative difference is irrelevant. So what if you just grossly overfeed people? This is another study by Schwartz and Hellerstein, where they took people, again, young, healthy males, and they gave them up to 50% added carbohydrates, 1,500 calories added carbohydrates above their regular diet. How much fat did they produce? 3.3 grams. 3.3 grams. These people were consuming 700 grams of carbohydrate a day, and they were generating 3 grams of fat. Again, the percent goes up. Looks like it's a really big problem, but the overall amount of fat is very, very small. I'm glad that Rob and I share one slide. I must say that makes me feel good. This is a study by Hudgens, and Mark Hellerstein is the senior author on this paper, too. There's sort of a trend here. And so I talked to him about this. What does this mean? Well, again, of all the VLDL that your liver is making, now if you give the equivalent of a supersized drink to obese people who are probably a little bit insulin resistant, you can make the percentage of that the palmitate in that VLDL go up to about 29%. Remember that this is delta in palmitate. It went from 26% to 29%. And as far as Mark Hellerstein is concerned, the quantity is irrelevant. That wasn't what this study was designed to do. This study was designed to create a method for assessing who is sensitive to fructose and for lipogenesis. Now, what about fatty liver disease and ectopic deposition of fat in the muscle? This is a subset of that 352 people that I've already told you about, 68 people who underwent unenhanced CT at the beginning, and after 10 weeks of consuming 8%, 18%, or 30% of their calories as either high fructose corn syrup or sucrose. Again, pooled data. No difference between 8%, 18%, and 30%, and no difference between high fructose corn syrup and sucrose, and no increase in fatty liver. 13%, 13.2%, 13.3%, about 1/10 change between the beginning and 10 weeks. So in our hands, no increase in fatty liver. What about ectopic deposition of fat into the muscles? Again, a diagram from Luke Tappy. According to Dr. Tappy, we don't have data in humans about how much of the fructose gets metabolized in the intestine. A little bit, maybe 10 or 12% from animal data. That feels like a good estimate. We don't have accurate data in humans. But what about the rest of it? What happens to the rest of it? It all goes to the liver. And what happens when it goes to the liver? 50% of it is turned into glucose. 25% of it is turned into lactate or burned off, goes to CO2. At least 15% goes into glycogen. Somewhere in the single digits goes to fat. Incidentally, when you give people 1,500 extra calories from carbohydrate and only 3 grams of fat get generated, where's the rest of it going? To glucose. A 40% increase in glucose in those experiments. There's only one natural trial of showing, and so as what Mark Hillerstein says is, you can make somebody fat by feeding them extra carbohydrate, but it's not because it's turning it into fat, it's because it's blocking oxidation of fatty acids. So it's a very important point. Yes, de novo lipogenesis increases from almost nothing to a little bit. It looks like it would be more than it really is, but everyone who has looked at this, Tappy, Hellerstein, there's a large literature on that, and I've given you the 2 big reviews, have been consistent that when you consume glucose and fructose together, you make a little bit of fat, not some disastrous amount of fat, some single digit, a few grams, which in the overall energy economy is trivial. What about in our hands? Looked at MRIs of muscle at the beginning and the end of the study. They were the same. No changes. Now, George Bray has, I'm almost done. George has said it's different from the Maersk study. A very good study. I can't explain it. I can just say that there are data on both sides of this. 2 studies that Luke Tappy did. One found ectopic deposition. You had to give 3 grams of fructose per kilogram, huge amounts of fructose, in order to get any amount of deposition of fat in either the liver or muscle. Silbernagel found the same thing, no increase. There's a real debate here. Is this really true? It's not just one-sided. Some people have found it, other people have not found it. The Maersk study, the people were 50 pounds heavier than in our study, and they also gained fat. So in conclusion, no unique relationship between high fructose corn syrup and obesity in our studies. No metabolic difference between high fructose corn syrup and sucrose. They're both different from fructose and glucose. No adverse effects on lipids, no adverse effects on blood pressure, no increased risk factors for metabolic syndrome, no fatty infiltration of the liver, no fatty infiltration of the muscle. Let's be careful. Everybody needs to take a deep breath here. We've got a lot of data that shows what really are the risk factors for obesity, diabetes, metabolic syndrome. Hundreds of papers on that. We need more randomized controlled trials at normal population consumption levels in the way we take these things. ASN should and can play a role, and I would just conclude, when you hear hoofbeats, look for horses. What we're looking at today is a zebra. Thank you.
Okay, thank you.